What is up, class, and Dr. Keller Johnson? So today I will be going over the basic anatomy involved in our case for the left acoustic neuroma. So we're going to start off by saying this structure to me, the complete anatomy model, kind of looks like that SpongeBob episode in Halloween when he shaved his whole head down and only had his brain, but that's besides the point. We'll kind of move on. So on our MRI imaging, we saw that one of the involved bony structures was the internal meatus. Internal auditory meatus, which is going to be right here, and it has three structures that are going through it. I'm going to kind of zoom in, and those three structures are including the facial nerve, the intermediate nerve, which kind of coincides with the facial nerve in that it helps with the taste of the tongue, and also the vestibulocochlear. Now if we zoom out, I'm going to get rid of the bony structure of the temporal bone. I'm also going to get rid of the sphenoid, just trying to get rid of some of the bulk so we can kind of get to the midbrain. Going to get rid of the trigeminal ganglion. Zoom in a little bit. Oop. Let me hide that again. Coming here, zooming in. So now we're kind of seeing that general area right here where I was trying to look at before. So on our MRI, we saw that it was between the medulla and also the pons, which is right here. So the pons and the medulla, but in this case, it is showing the olive. Anterior to the olive is going to be the pyramid of the medulla, and posterior will be the myelencephalon. So again, I point out these three structures, these three nerves right here, because our patient was presenting with decreased hearing, dizziness, facial pain, and decreased taste. So based on our MRI imaging and that we were shown, we were seeing that the growth was right about in that general vicinity. And if I were to draw, I'm not the best drawer, but I'm going to try. There we go. We assumed that it is engulfing all three of these nerves. This stretches out to the glossopharyngeal. Obviously, I said I'm not the best drawer, so I would just disregard this portion. But it would include the vestibulocochlear, the intermediate, and also the facial nerve. And that would help us come to the conclusion that the symptoms and signs that our patient is presenting with come back to these nerves. So we're going to keep moving on with our presentation from this point. Let's keep going.